Variants of schizophrenia with recurrent. Relevance of research. The relevance of the study is due to the high prevalence of schizophrenia with a recurrent course and a number of unresolved issues, including its typology, the clinical attacks and remissions, therapy, the problem of adaptation and social functions of patients, the frequent occurrence of productive disorders during the remission period is the most significant factor leading to impaired working capacity. In this regard, the determination of the patterns of remission formation in schizophrenia with a recurrent course, the assessment of their prognostic significance, the development of educated social therapeutic approaches that contributed to the preservation of the optimal level of social functioning of patients seems to be a very relevant task. Research objective to determine the variance of recurrent schizophrenia depending on the psychopathological symptoms in remissions. Materials and research methods. To solve this task, we conducted a clinical epidemiological, clinical psychopathological, clinical anamnestic, and statistical examination of 188 patients with recurrent schizophrenia. The main group: husband 86, woman 102 with a disease duration of over 15 years, aged 30 up to 83 years old, registered in the Andean Regional Neuropsychiatric Dispensary as a control group. We examined 40 patients with paroxysmal progressive schizophrenia, representative gender and age: husband 22, woman 18. In the assessment of progressiveness of the process in schizophrenia with a recurrent course and the state of patients in the remote stages of the diseases, we asked social and clinical criteria. Social criteria play an important role in the assessment of progressiveness of the schizophrenic process, as they allow us to judge how strongly the destructive processes of the disease have been released on the one hand and how much the rehabilitation possibilities of the patients have remained preserved on the other hand. As social criteria, we asked the relapse of social level adaptation. Level 1. Preservation of social level adaptation at the premorbid level. Level 2. Reduction of the social component preserving the professional. Level 2. Reduction of both social and program components. In adaptation based on a complex of clinical and social criteria, we identified three rates of progressiveness of schizophrenia with an episodic course: A. Weakly progressive, variable 1; B. Moderately progressive; C. Pronounced progressive. A comparative analysis of the distribution indicators of patients with schizophrenia with a recurrent type of course according to the levels of progression reached depending on the type course showed that a weakly progressive rate of progression correlated with schizophrenia with a recurrent type of course. A pronounced progressive type, on the contrary, was much more often observed in schizophrenia with an attack-like progressive type of course. The following were asked as clinical criteria the nature of the onset on the disease, the clinical features and durations of the manifest attack, the clinical features and duration of the first remission, and the number of episodes experienced. Based on taking into account the progression of the course of the disease, the rate activity of the process, the combination of negative and positive symptoms in remissions. We identified the following variants of schizophrenia with a recurrent type of cause: maximal regredient with a temperature constitution of progredient, regredient with a transition to progredient, weakly progredient with a transition to regredient, progredient with a temperature transition to regredient, and as progressive as possible. First variant, maximum regredient. Maximum regredient, 3 subvariants identified. Second variant, regredient with the temperature transitions to progredient. 2 subvariants identified. Third variant, regredient with transition to progredient. Third subvariants identified. False variants. Second podvariants identified. Fifth variants. Fifth subvariants identified. Sixth variants, maximum progredient. Sixth subvariants identified. All this described variants of the cause of depending of research depending on the dynamics of psychopathological symptoms in remissions were combined into 3 main groups. 1. Maximal regredient and weakly progredient with a transition to regredient, a variable course option. 2. Regredient with a temperature transition to progredient and progredient with a temperature transition to regredient, a moderate course option. 3. The maximum progredient and regredient with the transitions to progredient in favorable variants of the cause. Summary: the maximally regressive variant and the weakly progressive with a transition to regressive variant were observed with all favorable parameters of the cause of schizophrenia with a recurrent cause. The maximally progressive variant and the regressive with a transition to progressive were clearly associated with an unfavorable cause of the schizophrenia with a recurrent cause. Both in terms of the assessment of the rate of progressiveness at the time of examination and in terms of the clinical parameters which we indicated above. In a comparative analysis of indicators of the rate of progression of recurrent schizophrenia and the variant of the cause of the disease, it was found that a weakly progressive rate of progression was somewhat more often observed in 77 patients, and the unfavorable variant of the cause, on the contrary, significantly more often correlate with the pronounced rate of progression of patients with schizophrenia with a recurrent type of cause. Conclusions. Consequently, maximally regredient and weakly progredient with the